Well, this may feel more like a formality, but the official national emergency response to the COVID pandemic is now over.
President Joe Biden signing a resolution to bring it to a close after 3 years. So what does it mean for you? Tonight, Teacher 11's Julissa Garza explains.
The national emergency allowed the federal government to take steps to respond to the coronavirus, supporting the country's economic, health, and welfare systems. But 3 years later, and that help is coming to an end. So here's how it might impact you. One of the biggest changes is the cost of COVID-19 tests. According to the U.S. Department of Labor, your insurance plan may no longer be required to cover the cost of over-the-counter tests. You might be responsible for paying all or part of the cost, but it depends on your insurance provider. Secondly, COVID-19 vaccines. Your health insurance could now require you to pay if you get a vaccine from a place not in your health plan's network. Third, telehealth became popular the past few years. A lot of health insurance plans expanded to include it, but that may no longer be the case, again, depending on your plan. Medicaid coverage could also change. If you or your family members are covered by Medicaid, now is the time to check if your coverage will continue.
The renewal packets have been going out, and we've been preparing for this for more than a year. We didn't know exactly when the public health emergency would end, but we knew a year ago that it was on the horizon.
Gavin Lesnick with DHS says those who qualify will keep their coverage, and those who don't will be transitioned to a different plan.
During the public health emergency, beneficiaries on Medicaid, for the most part, couldn't lose coverage. Even if their circumstances changed and they would no longer qualify for the program, they were not disenrolled.
DHS has been reaching out to Arkansans since February and reminding people to keep a close eye on the mail.
Making sure that they're aware that a change is coming.
Julissa Garza, THV 11 News.
And hopefully you got one of those alerts from DHS if your eligibility is changing.
And if it is, Blue Cross Blue Shield, by the way, has set up assistance centers in Central Arkansas, in Hot Springs, Little Rock, and in Pine Bluff.